Hello everyone. My name's Bhavini Makwana, Campaigns and Projects Manager here at Thomas Pocklington Trust, and welcome everyone to Eye Care and You webinar 26, Demystifying Cataracts. So we're going to be hearing from Dr. Hari Jayaram, who will be talking to us about cataracts, signs, the symptoms, when it's okay and when it's not okay to surgically remove them, and answer any questions you may have. So without further ado, I'd like to invite Dr. Hari, who will introduce himself and then start the presentation. So Dr. Hari, over to you.
Good evening. So my name's Hari Jayaram. I'm a consultant at Moorfields Eye Hospital in London, and I'm in charge of the glaucoma service, and I specialise in glaucoma and cataract surgery. So this is quite an interesting title for me because in the eye care profession, we take cataract for granted because it's something we do all the time. But I understand completely if for people that haven't been exposed to this, or maybe haven't had a family member that's been either had cataract surgery or been affected, it can be a bit of a mystery. So what I'm going to do is just quickly explain, set the scene, and then I'm going to go through what are some sort of common myths about cataract surgery and see if I can sort of go through those with you. And at the end, absolutely happy to answer any questions, because I'm sure I won't cover everything that is mysterious to our audience and most of the public today. So just briefly, I'm going to just set the scene about cataract surgery. And cataract development is one of those inevitabilities in life. As it's as common as birth, life, and death as we get older. We will all, to some extent, as we get older, some people when they're younger as well, develop cataracts. And it is actually across the whole world, it's the leading cause of reversible worldwide visual impairment. So, that means it causes problems with the vision that we can treat and therefore reverse. It's actually one of the commonest operations performed in the NHS in the UK. And the most recent sort of data that was available was actually the last sort of normal year, as it were, before the pandemic, where almost 500,000 surgeries were performed just in the UK alone within the NHS. And so I'm just going to start with this. And this is questions that, quite often people would ask us. And I've often been asked, what is a cataract? Is it like a growth, or anything like that? Is it something that I need to be worried about? And this is quite a common misconception, actually, because actually what a cataract is just clouding of the lens within the eye. So if you imagine you've got a camera and you've got the clear glass lens that sits at the front that then focuses the light on the film, the cataract's like the lens like the lens in your camera. So it's not a growth, it's just some clouding that develops over time. And the reason for this is the lens is made of various proteins that are aligned in such a way that light can go through them without being scattered around. And as we get older, for various reasons, it could be due to medications or exposure to certain types of light, or really natural aging, these proteins become less elastic and they begin to stick together. And this means that light can then not pass through without disturbance. And it's at this stage that cataracts can cause people symptoms. So you may notice problems with your eyesight and activities of daily living. So they're not really growth. They're just sort of clumping of proteins within the natural lens in the eye. And then this is another quite a common misconception, is that cataracts only affect people in advanced age. Now, we do know that age is probably the biggest contributor to developing cataracts, because these proteins in the lens tend to sort of clump and change as we get older. And, for example, let's say by the time you reach the age of 80, probably about half of people will have cataracts that are affecting their eyesight or have affected their eyesight. But it's not just age, because we do get people who are much younger, and even sometimes babies that are born can be born with cataracts, which we call congenital cataracts. There are various genetic disorders, and sometimes people that have had injuries to the eye can have cataract develop at a younger age. We also know that smoking and diabetes, and also the use of steroid tablets, and sometimes steroid drops and nasal sprays even, can speed up the development of cataract. And if you were to look at our younger patients in eye hospitals, usually younger patients will have one of these other sort of underlying medical issues contributing to it. So I think, the reality is, yes, the in the majority of cases, age is the common factor for cataract development, but it can affect younger people as well. I've also been asked, can cataract spread from one eye to the other? And I can understand why people may think that, but cataracts don't spread. They may develop in both eyes roughly at the same time, but quite often eyes can be slightly different. So you always assume that what happens in one eye will happen in the other, and that's not necessarily the case. So it's quite common that we see people with a cataract in one eye more so than the other eye. But there's no mechanism as such that makes them spread from one eye to the other, which is something that I have been asked over the years. Now, in terms of how they affect you and the symptoms they cause, it's not just making your vision a bit blurrier. I mean, that's really just one possibility. Now, I mentioned earlier about how the proteins clump up, and instead of the light coming straight into the eye, these clumps of proteins make the light sort of scatter around. So instead of going straight to the back of the eye to be processed by the brain, light can be scattered around. So therefore, the images that we perceive in our brain aren't what they should be. Now, blurry vision is one thing that can happen. Sometimes people notice that colors can be little bit different. And what's quite interesting, if you look at some of the artwork by Picasso and various other artists as they get older, you can see that the colors change in the artwork they do. And one of the reasons for that is that when you develop cataracts, typically you filter out much more blue light, so people don't perceive blue colors to be as intense as they normally are. So you can get color changes. Now, the other thing that can happen is if you have light scatter, it can cause glare, and particularly in low light conditions. And one of the common things that people tell us is that when they're driving at night, when people have oncoming headlights, they have a lot of glare with light scattering around. And that's very, very common, a very, very common symptom that people have with cataracts. And sometimes you can, due to the protein clumping, you can have some halos around lights that you see, and even some double vision. So because the light's being scattered around, you can instead of, let's say, if you're looking at somebody's ear, you might see two ears rather than one ear. So that can also be because of cataract. So it's not just blurry vision that people experience. This is probably one of the commonest misconceptions that people talk about. And if you speak, whenever I've spoken to my older family members and even our more, our older patients, the perception from many years back was that cataracts need to ripen before considering surgery. Now, I think in the past that used to be the case because surgery was much higher risk, 30, 40 years ago. And technology wasn't so advanced. So people used to wait until cataracts were quite significant before considering surgery, really because back then it was quite a difficult judgment to balance the risks against the potential benefits. But because technology has really advanced in leaps and bounds at the moment, we actually operate on cataracts at quite an early stage. Usually, as soon as people notice some symptoms or have some problems with their eyesight. And I think really what this means is when you operate earlier on cataracts, you do get much more choice over treatment and quite often better outcomes. And from a surgeon's point of view, if somebody presents to us, 30, 40 years down the line with very, very dense cataract, surgery is more challenging and is at higher risk of complications. So, this is definitely a misconception that's not true. So, the time to operate on cataracts or to consider surgery is when it's impacting your activities of daily living, really. In the 1970s, cataract surgery was, it was quite a complex procedure. People would be asleep for this, so a general anesthetic. I remember at Moorfields seeing pictures of people lying in sort of rows of beds in inpatient wards. People would stay in for a couple of weeks at a time, and it's actually very, very different now. And it's now all performed under local anesthetic. So if people have cataract surgery, I would say 99% of the time people are awake. We can numb the eye in various ways so you don't feel anything. Sometimes we just use lots and lots of eye drops and a little injection inside the eye that stops people feeling any pain or discomfort. And more commonly, we actually give a little numbing injection around the eye that actually doesn't involve any needles at all. That stops the eye moving. It stops you seeing things, and stops you feeling any pain or discomfort. Very, very rarely we do perform cataract surgery under general anesthetic, and usually that's in children. That would be the case. Or, for example, if somebody isn't able to lie still, typically it may be if people have quite significant dementia or other medical problems like that, we may need to consider general anesthetic. But it's very, very unusual actually to do cataract surgery under general anesthetic these days. And in terms of the length of the operation, it typically takes between 15 and 20 minutes. And that's all really. And in terms of, if you think back to the 70s where people stayed in hospital for a few weeks, normally people are in and out of hospital in 3 to 4 hours. So typically people would arrive either first thing in the morning or at lunchtime for a morning or an afternoon operating list, and you're home a couple of hours later. This is also something that has put people off. And I completely understand, it's the thought of having an operation on your eyes is quite a scary thing, really. But actually, cataract surgery itself, once you've had the local anesthetic, really causes little to no discomfort at all. So the eye itself doesn't feel a thing. You will always feel our hands around your head because we don't numb that part of the body, but the eye itself doesn't feel anything. And the drops that we use to numb the surface of the eye are very, very fast acting, and they start to work within minutes actually. So it's very, very unusual for people to feel any pain or discomfort during the operation itself. It's quite common for people to describe that their eyes feel a little bit gritty or scratchy, and that's really because it takes a little bit of time for the small incisions we make to heal over. So it's common to have a sort of gritty sensation, but that usually resolves within a few days after the operation. And you can use painkillers like paracetamol, but being honest, in all honesty, it's most people don't need to use any painkillers at all after cataract surgery. The other thing that people are worried about, especially if people are working and have careers, people are very worried about time off work and how they're going to, or for example, if they're carers for other people, is this going to impact their responsibilities? And the reality is that after cataract surgery, yes, there are things that we ask you to sort of take it easy from, and I'll talk about those shortly. But the majority of people are able to get back to daily activities normally within about 24 hours. You may well have a pad or a dressing over the eye, depending on your type of anesthetic, that's there overnight. And then from the first post-operative day, usually people put lots of eye drops in for about a month or to 6 weeks. But you can pretty much get back to normal. It's normal for the operated eye to be a little bit blurry for a few days as it starts to heal, but it does improve significantly during the first few days and weeks after the operation. The only thing that we tell people to avoid is heavy lifting and straining for the first week. And the reason for that is the incisions we make are absolutely tiny. So we make 3 incisions usually. Two of them are 1 millimeter in size, And the third one, which is the bigger incision, is about 2.5 millimeters in size. So if you think about the size of those things with the naked eye, these are absolutely tiny, but we just want those to heal up without any sort of pressure or squeezing to happen. So that's why we normally say avoid heavy lifting and strenuous work for the first week after the operation. But really, most people can resume normal tasks very quickly. The other thing one thing that patients often ask me is, when you have cataracts removed, is it done by laser? Now, there was a stage a few years ago where lasers were used to assist certain steps of the cataract operation. Even now, some people use a laser at various points in the operation, but that's not very common actually. It was quite fashionable about 10 years or so ago, but then there was a trial looking for any benefits, and there wasn't really any significant benefit of the laser. So actually, cataract surgery is a sort of a traditional operation, and what we do is, through these small incisions, we use ultrasound. So it's almost like, sound waves, high intensity sound waves to break down the lens. So it sort of breaks down the lens proteins into little bits, and it then acts like a hoover to sort of suck them away. So it's sort of like a probe that breaks things down, and then it sort of hoovers away the little pieces. And at the end of the operation, we put in a plastic lens that unfolds in the eye. So we put it in sort of rolled up, and it unfurls in the eye and stays there forever. And we calculate that using special measurements done in the clinic when people have their assessment. So at the moment it is a traditional operation, although done through very, very tiny incisions with a very, very quick recovery. And it's something that can't be treated just by laser alone. And I remember when I started my training, someone said to me, so when you do the operation, do you have to take the eye out and sort of put it on the cheek? Now, first of all, that's not humanly possible to do. And actually, the way we access the eye is just by putting a little metal clip to hold the eyelids apart. And that's all the access we need to make these very, very small incisions. So the eye stays exactly where it is. And we do the surgery just with people lying down. And one thing people always experience is a very sort of bright light that people may be aware of, because the eye is so small, we do our surgery under an operating microscope. So we look down a microscope and our hands are underneath when we're doing the surgery. About 10-15 years ago, in fact, every few years this happens. There are some people that come in, normally from Russia, that's the typical source. Then they will come on, you'll either read about it in the Daily Mail, or they used to be on the ITV morning breakfast shows, coming in and saying we can treat cataracts with exercises, and we can treat them with eye drops that will dissolve the cataracts. That's not true. At the moment, there's no evidence to show that any drops or even eye exercises alone or anything like that can stop cataracts or reverse cataracts once they're there. It does require surgery, when it's at the stage that it's affecting your eyesight. And I think one of the most important things to remember is that just because somebody has some cataract there, it doesn't necessarily mean that they have to have an operation. So, like I said, if about 50% of people, at the age of 80 will have some cataract there. Now, so if you go to your optician and for a routine eye test, which everybody ought to do every 1 to 2 years, it's highly likely that if you're aged 80, that your optician will say, yes, you've got a bit of cataract there. Now, that doesn't mean that you have to come to a hospital to have surgery. So the time to think about surgery is if you're having problems with your vision, you're not able to do the tasks that you need to do. You're struggling, for example, with driving. And driving's an interesting one, because the DVLA have set criteria about what you need to read on the letter chart to fulfill their requirements to drive. And that's something that your optician will tell you. So if your optician feels that your eyesight is getting to the stage where the DVLA might be a little bit worried about you driving, they will tell you to, or they will certainly ask that your GP to make a referral to a hospital eye clinic. Because it may be that you think you're driving fine. One of my colleagues did a study in North London about 20 years ago, and they actually found that probably about 40% of people driving didn't necessarily meet the requirements that the DVLA needed, because they felt that everything was fine. So I think this really emphasizes the importance of regular screening and just visiting your optician for a general eye checkup at least every 1 to 2 years. So they're the main things that I wanted to go through today. But really, just to conclude, cataract surgery is one of the commonest operations performed across the world. You're usually in and out of hospital in a few hours, and it's performed under local anesthetic with you awake, and it's not going to be painful or sore. And it's a very safe and effective operation these days. All surgery has risks, but with cataract surgery, the risks are very, very low. So statistically, we know that in about 1 in 1,000 cases, there may be a problem with infection or bleeding that in theory could make the sight worse in the eye. These things are incredibly rare and actually almost impossible for us to predict. So it's one of these things that, statistically things can always happen with surgery. But with cataract surgery, the risks are very, very low, actually. And then the other sort of real take-home message is that just because you may have some cataract there, you may not need to have an operation. So please don't, if your optician says, you've got some cataract there, please don't be worried and think you need to have something doing. If you're happy with your eyesight and you're able to read and do all the tasks that you need to do. So really, that was all I wanted to talk about. But I'm happy to answer any questions because it's such a huge subject, and I'm sure you all have a whole host of things that I haven't even touched on. But I'm happy to try and answer any questions now, really. So please do ask away.
Hi, sorry, before we go into questions, sorry, I was muted. I just want to say thank you to Dr. Harry for a great presentation, and we will go through the Q&A and the chat in a very, very short time. I just want to remind people that our next webinar, the next Eye Care and You webinar, number 27, will take place on Tuesday, the 13th of August. They always take place on the second Tuesday of the month, and the topic will be myopia. So please do look out for the registration link and details for that.